Across the nation, the way we approach maternal health needs to change. The data and the voices of patients make it clear we're not meeting the needs of all mothers and babies. Supported by Dartmouth Health, from its inception, the New Hampshire Perinatal Quality Collaborative is creating a new approach. With core staff and operations housed at Dartmouth Hitchcock Medical Center, NHPQC unites patients and families, clinical providers, healthcare systems, community services, and policy influencers to build a statewide movement for better maternal and infant health through a system of local coalitions.
We, from the beginning, knew that we needed to involve the community and create community-driven change if we wanted to move the needle at all on maternal health. We spent an immense amount of time in the building up to our first Maternal Health Summit, where we were just following somebody who knew somebody who knew somebody at all the different community organizations. We've seen those numbers growing, and we only intended to launch 4 coalitions in the first year, and because people were so enthusiastic and so ready, we ended up launching all 11.
The way the leadership team was set up from the beginning was community focused. So we have people like me, moms, people in recovery, doulas, people from all different kinds of careers and experiences across the maternal health field. So our little leadership team meetings were a mini community, right? So then when we carried this work forward into the NHPQC and then the local coalitions, it was a model of that. The voices of those of us with lived experience contributed to that in terms of language, in terms of phrasing. There was a lot of discussion that we had about those things. So everything is patient-centered. It's at the heart of what we do.
The NHPQC has been a really great landing ground for organizations like Black Lives Matter New Hampshire or Central Latino or the Black Women's Health Project, because there are so many powerhouses in these organizations, and the NHPQC has given us a place to bring all of us together. And I learned quickly that you could bring your infant with you. And that was a game changer for me, to be able to be in this space, in the work that I love, but also bring my baby with me. It's really humbling and honoring to be a part of that.
We know that moms can feel very alone, they can feel very stressed, they can feel very anxious and need to have a network of support. They may not necessarily want to go to professionals, but they do want to have people they can turn to. They want to know who are the resources in the community, not necessarily at institutions, right? So if we can have strong networks where maybe a mom reaches out to one entity, but that entity knows how to plug that mom into other kinds of support they may need, so they can be successful in raising that child and really thriving as a family.
My area of expertise in supporting maternal mental health is pediatrics. So this is where we see the moms the most. Sometimes they don't always make their own appointments or prioritize themselves, but they will for their baby. So I'm able to give those moms those tools and those strategies in the pediatric setting. That's never been done. I helped create the New Hampshire Mom Hub. So this is a centralized perinatal navigation access point. So moms can get resources, have peer navigation, so talk to another mom that's been through similar struggles and get connected throughout the state. So the work with the NHPQC is really important because the different coalitions provide the resources in all those different areas of the state, and then we're able to navigate those resources for the moms with the New Hampshire Mom Hub.
I got involved with the New Hampshire Maternal Health Coalition because there was a need for women of Afro descent in the state of New Hampshire to have a voice. And so I ended up getting involved, and we ended up partnering with the New Hampshire Black Women's Health Project, where we focus on mental health and racism. We need cultural competency for whether it be a midwife or a OBGYN. It's important that we are being heard so we can stop dying and so our babies can stop dying.
Not about us without us should be the mantra for all public health work, including maternal health. Seeing the community as an equal partner helps to support the crucial and overall goal of healthy moms and babies.
So this work's about connection for me, bringing community voices and data together, and that can create real change for moms and babies.
I get to give back and be supportive of other peer mentors and peer workers throughout the state, and give them the type of support that I wish I had had when I was working as a peer worker.
I am a parent of young children, and so I connect very deeply to some of the challenges and struggles that other parents might go through. And I just love to see, the improvements that are made and the connection that people feel.
This is a movement in New Hampshire that feels very different than a project. It's people across the state from all factions of healthcare and the communities that are coming together to say real change needs to happen, and we're going to make it happen.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.